From lashes for days with the viral Liquid Lash Extensions mascara to awakening your eyes with lift and color from the Brilliant Eye Brightener, Thrive Cosmetics is the go-to when you want to amplify your everyday look. Plus, every product is 100% vegan, cruelty-free, and made with clean, skin-loving ingredients that work with your skin. And for every product purchased, Thrive Cosmetics donates to help communities thrive. So every time you use your favorite Thrive Cosmetics product, you're helping communities you care about too. Amplify your everyday. Go to thrivecosmetics.com/shine26 for an exclusive offer of 20% off your first order. That's Thrive Cosmetics, CAUSEMETICS.com/shine26.
Hi there, and thank you for joining us on the Overcomers Overcoming podcast. We feature those who are in the process of overcoming or have overcome any type of life encounter, life obstacle that at the time seemed to be almost insurmountable. With this podcast, we have three objectives in mind. Our first objective is we want you to know with a confident resolve you are not alone. We want to work with you. We want you to know there are others who are working with you, who want to help you through whatever you are encountering, and together we will get through whatever you're experiencing.
Our second objective is there are multiple options for any life encounter you are facing. We want to help you develop a resolve that there are various options and solutions to any life dilemma.
Our third objective is to help you with critical thinking skills. If you're encountering something that was possibly a decision you made sometime in the past, and if you had the opportunity for a life redo, you would make a different decision. We want to help you with those critical thinking skills that can help you make an informed decision and not encounter what you're going through at the moment. We are the Cooper Culture, a veteran-owned business. We work with business personnel and families to develop and sustain connected relationship cultures within their families and organizations. That type organization is one where people feel wanted, appreciated, and genuinely a part of that organization. I'm with my wife and business partner, Marty, who is helping me facilitate this podcast. Today we feature Dr. Jeffrey Knight, who discusses with us neurodiversity, a discipline he started after entering the chiropractic industry. He wanted to help those that were neurodiverse, are neurodiverse, and help understand exactly what it is they are going through, what the conditions are, and is it something permanent or is it something people who are neurodiverse can overcome. It is very interesting insight that what he has. One of the common themes we are learning through our research and talking with others is nutrition is one aspect, but not the only aspect. But Marty, what are some takeaways we gained from Dr. Jeff Knight?
Dr. Knight, in his write-up, and one of the reasons, the many reasons I requested that he become a guest on our podcast, is that he was following what he thought he wanted to do, his career. And God kept speaking to him, no, I want you to go in a different route. And finally he did. And so his vision became a goal to help children with autism become the happiest, healthiest version of themselves and to help them be able to live independent, happy lives and contribute to society in a positive way. Because these children have a lot to offer. And even though they think different, they think, and they even help us that I don't think I have it, I might, but can help us think through things that we wouldn't think that way.
His research applies not only to children, but adults with neurodiverse conditions, symptoms. Let's listen and learn together. Dr. Jeff, it is great to have you with us. As I have learned to know you and I've read about you, you are very knowledgeable of, and you've done a lot of study on neurodiversity. For any of our listeners who are unfamiliar with that term, it's, from our perspective, it's some people know it frequently as autism. ADHD, obsessive compulsive disorder, those type things. It is my understanding, and certainly I hope you'll correct me during this recording if my thinking is wrong, but it is my understanding that autism and any neurodiversity is genetic. That is, you're born that way. You'll always be categorized as or described as, or your brain will always be assessed as neurodiverse. That doesn't mean you're not employable, doesn't mean you don't have intellectual talents, doesn't, in my opinion, doesn't mean you're disabled at all. It's just the way your brain is wired. But with that as an understanding, or at least my interpretation, Dr. Jeff, we are very interested in your understanding, your research, and how we can work with those who are neurodiverse. Dr. Jeff, it's great to have you with us.
Thanks for having me on today. Yeah, thank you for having me, and I appreciate that introduction. And I'll share that same mindset that I had once upon a time as well. That I believed that neurodiversity was, I guess you could say, a lifelong diagnosis. That it was something that was going to be that way forever. And actually, it was. I had this huge moment when I was actually in chiropractic school. So I'm a doctor of chiropractic. I graduated in 2012, and my very last term in chiropractic school, I had this awesome opportunity to go to a functional medicine seminar. It was a 5-day event down in Southern California. And I'll share with you an experience I had that really opened my eyes to realize that what you had just shared and what I had believed before, that once you're on the autism spectrum and you are that way, that there's nothing you can do to change it. And the argument, yeah, a lot of people do say that it is genetic. And I've got some thoughts around that as well that I've learned over time where it's hard to say that it truly is 100% genetic. Do genes have a role into it? It does, but it's if it was purely genetic, then it wouldn't explain the rapid numbers that we're seeing over the last 20 years of individuals that are being diagnosed on the autism spectrum. Because genes don't change and evolve that quickly. Genes do change over time, but definitely not as fast as what we're seeing in terms of the cases with where autism is now like 1 in 36. In some parts of the country, it's even 1 in 22, and it's the numbers continue to increase. So at this rate, who knows where it's going to be in the next 5 to 10 years, unless there's something we can do to correct that. So, but let me go back to that story of where when I was in school, and what it was. So I was sitting in this conference, and in my very last term of chiropractic school, I went to this functional medicine seminar. There were incredible speakers and all week, but there was one in particular that really caught my eye. And in fact, there's a few things I took from that whole 5-day experience, and this was the one that was the most impactful. And at the time, I didn't realize it, but this was something that changed the trajectory of my career. And I'll explain more about why. So one of the doctors, he got up and he was sharing a story about a 3-year-old child that was on the autism spectrum. This child had come to his office with his mother, and the child that was all over the place. The doctor actually captured all this on video. He couldn't sit still. He was nonverbal. He was all over the place. He couldn't look you in the eye. He never really showed any kind of affection to his family. And that was basically the reality of what his life was like. And so the doctor then put him on a program, like a specific plan, basically, and he focused a lot on the diet, on good nutrition. He focused on gut health. He focused on good supplementation as well as detoxification, to help remove things that are creating stress on the body. And the fascinating thing that happened, so a few months later, the child came back for a follow-up. The doctor filmed that episode as well, and the change was drastic. It was absolutely incredible. The same child who couldn't sit still was now sitting calmly looking at a book on a chair. And his mother reported for the first time that he actually said the words, "I love you, Mom." I was in shock. I was absolutely in shock. I'd always been told, like you, that autism was a life sentence, a permanent neurological condition. And in that moment, I realized that a diagnosis of autism does not have to be the destiny of that child. And so from that time, it pricked my heart in such a way that I was just like overwhelmed with like awe and wonder. I didn't do anything with that at the time because I never even considered getting into the world of autism. I just was fascinated by that, but I never forgot it. Fast forward a few months later, I graduate from chiropractic school with my doctorate degree in December of 2012. And literally 2 weeks after I graduated, and I know you are people of faith, so I feel comfortable sharing this. 2 weeks after I had my graduation, my 2-year-old daughter at the time woke up in the middle of the night, and she was hungry. So I went and grabbed some milk. I warmed it up a little bit for her, put it in a bottle, and I was just holding her and feeding her the bottle. And this was probably at like 2 a.m.
Mhm.
And I'm sitting there, and in that stillness of the night, I had a very distinct, strong spiritual impression where God said, "Jeff, I need you to help these kids on the autism spectrum." And at that point, I was like, how in the world am I going to do this? I just graduated. I'm looking for a job. I need to provide for my family. My wife was pregnant with twins. We were about to have our fourth and fifth child, and we already had 3 kids. And so I'm just like, how in the world am I going to do this? Because I had no idea where to start, what to do, or what could be possible. But I remember that experience I had at that seminar, and I was like, okay, maybe there is something I can do. But but guess what I did? I did nothing. I did nothing. I didn't heed that prompting, and I continued to work. And it wasn't until I worked for another doctor for about 6 months, and then I decided to go on my own. I opened my own practice in October of 2013. And literally a month later, after opening my practice, I woke up early one Sunday morning before all my family had woken up. I was saying my prayers. And again, that same prompting came back. And this time it was more strong. And God's like, "Jeff, I'm serious. I need you to help these kids." And at that point, I'm like, okay, I'm listening. And anyhow, so from there, I would say I've probably literally invested probably close to $200,000 or more in continuing education, learning new techniques, learning different workshops, finding different pieces of equipment, every kind of different thing that I could have access to with my license as a doctor of chiropractic. I basically invested in everything that I could. In fact, my criteria for continuing education, because we have to have a certain number of continuing education credits just to keep our license, it had to meet one criteria. And that one criteria was, can this help a child on the spectrum if I went to learn this new technique or go and sit in the seminar or whatever? And if I could answer yes, then I would invest in it. And that's really what I started doing. And so I flew all over the country, went to all sorts of different seminars, and invested in some high-end coaching programs, that taught me how to detox the brain, how to detox the cells of the body. I did hands-on techniques. Since I'm a chiropractor, I learned some things that way, some different neurological techniques, invested in lots of different equipment. So anyways, that's been the journey I've been on since 2013. And I've made those decisions to be in service of getting really, really good at helping children with autism. And that's where I'm at. So So that kind of gives you a little bit of my background and a little bit about how I got to where I am now. And what I've witnessed is that children on the spectrum can change. And even though they are diagnosed with that, diagnosis, it doesn't have to be their destiny. Just like someone that has type 2 diabetes, it doesn't have to be their destiny either. That can be reversible. And why do I have so much confidence in this is number one, going back to understanding the way that God created our bodies. Our bodies are designed to be self-healing and self-regulating. You and I, if we get a cut in our hand, as long as we keep it clean and we don't pick at it, give it what, a week or two and it's all healed up, right?
Hmm.
Um, we are self-regulating in the sense that we don't think about how many red blood cells we make on a daily basis. Thank goodness we're not in charge of that. Otherwise, we'd all be in trouble. The beauty of our bodies is God has made it so workable that if we can focus on good food, and nutrition, getting good fluids, get good sleep, get some good movement and exercise, try to maintain good, healthy relationships, reducing stress, trying to serve others, trying to do good. For the most part, we're going to be in a pretty good place. Of course, there's a lot of variations to that, but a red blood cell, the life cycle of a red blood cell is 4 months. And the body will naturally recycle that and it continues to make more. When I eat a meal and I chew and swallow that food, I don't think about where those nutrients are going to go. I don't say, hey, today the spleen needs a little bit more today, or you know what, my big toe actually is needing a few more vitamins than it did yesterday. I have no idea how it does it other than I just know that's how the body works, right? I mean, and probably the most beautiful example of the divinity in our lives as humans is the sperm and the egg coming together and creating a beautiful child, right? 9 months later. And that has a spirit and that the body is thriving and of course it's an imperfect world. We do have things that we deal with, and that's part of our opportunity to learn and grow, and part of the way that God refines us, right? So there's a few thoughts. I don't know where you want to go with it from there.
I am in the moment with you, and I appreciate everything you just said. I am totally intrigued with the likelihood, I think, is how I'm processing what you just said, that even though now a person is diagnosed neurodiverse, the next thing that needs to be done, how I'm processing what you're saying, and please correct me, is we need to determine what their biological makeup is so that we can put them on a nutritional regimen that feeds the body that over time can correct the situation that's causing whatever the current diagnosis has brought about. If I have explained myself well enough that you could comment on what I just said, am I thinking correctly?
Yeah, I would say that there's definitely a lot of truth to that. Now, going back to the whole genetic concept is maybe you've heard this term before, but I like it a lot. I can't remember who shared it with me first, so I can't give the proper credit where it's due. But I heard someone once say our genes load the gun, and then our environment is what pulls the trigger.
Mm-hmm.
So basically, there may be some predisposition or there may be some different things in our genetic makeup that can put us in a position to where we might be more prone to have challenges with our health, whether it is neurodiversity, whether it is Alzheimer's or diabetes or cardiovascular disease or dementia, there's definitely those things that definitely can potentially mean we're we're maybe working behind the eight ball, so to speak. However, it doesn't have to be our destiny, right? So I know several families that have maybe multiple family members that all have diabetes or some kind of disease like that, but then there might be one or two, and it's like, well, they have the same genetic makeup. What are they doing different to help prevent them from having that chronic illness? So I would definitely say, if you have an understanding of your genetic makeup, that definitely can help. Is it absolutely necessary to have that? I wouldn't say it is necessary, but it's definitely helpful. I would say there's a lot we can learn from different labs that we can draw. So whether it's a, blood tests or some urine tests that can give us some insight. But then understanding too, just the world that we live in now compared to where it was even 40, 50 years ago, the world has become more toxic. We definitely, the there's so many different products that are sold in our stores where a small fraction of them have actually been fully studied to the full degree that they should to know how safe they really are in terms of like household cleaning, things or other products that are sold. So we get exposed to a lot of things that thanks to the world that we live in, we have a lot of, convenient things that make life a lot easier, but there has been a price that is paid with that. And sometimes it can create added stress or challenges for our healthcare. Um, and so I think if we are diligent in recognizing how to use good tools to give our body the tools it needs, it's amazing how we can literally just step back and in a sense say, okay, body, show me what you got. But there are going to be some situations that are a little bit more tricky, right? And there are some times where the journey might not be the sprint or even the half marathon, but it's maybe more of that ultra marathon that we got to run. And to some degree, there's going to be so many other factors that potentially could be contributing to why someone's just not getting well. I'll share an interesting experience that I had with one patient, and this isn't a patient on the spectrum, so this is more to teach a principle more than anything. And this was an individual. She had chronic thyroid issues, and she was actually planning on getting radioactive iodine to basically zap her thyroid and kill her thyroid cells. And she had come to me knowing that I had a more holistic mindset and I was kind of more open to looking at everything and anything that potentially could be going on. And so there's a lot of unique ways that we evaluate people in our office, and a lot of ways we can kind of determine if there's something that's off. And thanks to again all the training that I've received over the years, there's things that I got exposed to that I was like, wow, I never would have even thought to consider going down that path. And and one of those situations was basically this woman, I asked her about her dental history. Again, a chiropractor asking about dental history, that doesn't seem like it makes sense. But things that I had learned, there's some powerful connections with our teeth and the jaw that where our teeth are being held, that can have some connections with chronic illness. And so, because we had been checking off all sorts of boxes at this point in our journey with her, I was expecting to see some kind of changes because we had talked about diet, we had talked about nutrition, we had done some detoxing, we had done some other things. And I'm just like, what are we missing? And then I was like, oh yeah, I remember learning about this in one of the workshops or the seminars, conferences that I went to, is that if someone had a history of wisdom teeth removal or a root canal, that there could be an underlying hidden infection in the jaw that could be festering and preventing the body to heal the way that it needs to heal. And so I said, hey, there's a type of x-ray that you can get. It's called a cone beam x-ray. And if you do that, then let me have introduce you to a dentist that actually knows how to read it the right way. And it's kind of like a CT scan almost, but it's a little different. It's a three-dimensional x-ray of the jaw. And if you see what's called a cavitation, so a cavity is decay of the tooth, a cavitation is decay of the jaw. And if there's a cavitation in the jaw where there's basically like a crevice there, that's like the prime location for certain infections to dwell because it's dark, it's moist, and it's hard for the immune system to get to it. So there's people that have found like Lyme's disease in these areas, or parasites, or bacterial or other kind of infections that just fester. And it's basically like this fire is burning nonstop inside this body, and the body can't self-regulate the way it needs to unless we address the fire, right? So I recommended her to do that. She went and did the x-ray. They did find cavitations. She found a dentist that knew how to correct that, because not every dentist knows how to take care of those things. And she got the procedure done. And what's fascinating is her thyroid completely normalized after all of that. And that radioactive iodine that she was planning on doing to nuke her thyroid and just totally shut it off and basically kill it, she never ever pursued that. And her body was able to start to self-regulate better. And that was the environmental piece that was causing the stress internally for her. And so that's the principle that, in a sense, what we're considering when it comes to these kids that I work with that are on the autism spectrum, is doing that understanding of worst case scenario, potential things that could be inflicting more challenging circumstances for them to function and to thrive. And then, of course, providing the right tools to help them so that their body can naturally start making those changes. And as a result, we do see improvements with behavior, like less meltdowns. We see improved sleep. We see, better bowel movements. We see better social engagement, better self-regulation, better communication, better affection, and just kind of, I like the way one mom shared with me recently that I'm helping, and she said, it seems like my son, the lights have turned on inside. It seems like things are starting to connect. And we all want that immediate drastic change, but this is more of a journey. This isn't a quick fix type of a thing. But if we're patient and persistent, doing the right things over time, then we can have some confidence that good things will happen.
I want to take a very brief moment to tell you about myself, the Cooper Culture, a certified veteran-owned small business. I am a retired lieutenant colonel serving the Air Force for 22 years as an F-4 pilot, commander. I have 300 combat missions. I specialize in executive leadership training, team building, and workplace culture, where we help businesses to develop a culture of loyalty, trust, and by developing personality traits and personal strengths, we can help identify those traits that support the company's objectives. We do this through half-day and all-day training shops. I'm also a public speaker where I welcome the opportunity to speak with your group to help you develop your team to the point where people are loyal and they know exactly how they fit in the organization and contribute to your strategic objectives. Through that, you will have a very profitable company and a psychologically safe space where people know they can freely discuss everything about the company themselves, and we are always working together to progress. Contact me at ron@thecooperculture.com. Our website is thecooperculture.com. Look forward to the opportunity to speak with your group, work with your group, to take your group to the next level to where we soar together. Let's work together. Let me address the journey. I'll use that term. For the person who is on the spectrum, is there a thorough diagnostic blood test that can tell a person right away, hey, you've got you're going to need to correct your blood to do this, that, and the other thing? Or is a lot of what we're into right now trial and error?
There's definitely some labs that can be really helpful and insightful. So with someone that's on the spectrum, I would say some of the better labs that you could get. Now, I'm always a big fan of just a regular blood panel, like getting a CBC, which is looking at the red blood cells and the white blood cells. that is the most basic blood test of all, but I can get a lot of really good information just from that test alone, and it's super inexpensive. I also like the other regular panels that you can get, like a a metabolic panel. I like a lipid panel, which is where it shows you cholesterol. I like the iron panel as well. So again, some basic blood work can really give us a lot of information. It can definitely tell us a story as far as some potential things that might be amiss underlying. And I like that a lot. The other test that can be really helpful too is doing some form of genetic testing to understand if there's some genetic variations that might be part of the reason why they can't process things as well as maybe someone else. That's something else that can be helpful. I don't know if you've ever heard of mitochondria, but there's things that to understand how well the mitochondria are functioning. And I would say stool analysis can be helpful. I find it to be usually incomplete or not. I mean, I guess incomplete is a good word. It's, some people think of it as the gold standard for understanding if there's certain things that are off, and it can be helpful, but I would say that it's not always the case. And then, some urine tests can be helpful. There's some labs that I'll use that can actually test the levels of toxicity with like chemical toxicity, environmental toxins, glyphosate, which is a really big one. That's a big issue. Heavy metal toxicity like aluminum, mercury, lead, arsenic. There's several that can be oftentimes show up. But I'll say this, you don't need every test to really dive in and actually make a change. I know for a lot of families when they hear of all the testing and every family's different where they're at, but I mean that can be several $1,000s just to do all that testing. It's not cheap. The blood work's pretty inexpensive. The challenge with the blood work though is getting a child to actually allow them to put a needle in their arm to draw the blood out. And for some families, that's absolutely like a horrific scenario to where the trauma involved with that, it's not worth it. And some parents are just like, we tried and there's no way we're ever going to try to do the blood work again unless my child's like knocked out, which again, putting a child under anesthesia, I understand where there's a time and a place for that, even doing some dental work or doing something like that, maybe it does make sense, but that can be also traumatizing as well. So, I mean, there's things where you just kind of have to figure out, okay, what is possible? Can my child be tolerant of that? And if so, then great. Then I would say some of those tests can be really valuable. If not, then because I've been doing it as long as I've been doing it, I actually already have a pretty good understanding of what those labs would look like anyways, and what are common threads that we see amongst this population. And so the framework that I've created and the way I've structured my programs with families is I basically build in worst case scenarios to my framework to where it's like, oh, if you were to do that lab and it came back with this, well, guess what? We're covering it here. Or if you were to do that lab and we found this, well, guess what? We're covering it here. So I do that more for the sake of the family that is struggling financially. They don't have all the funds and resources to be able to invest in all the good testing that is available. And maybe it's because their insurance won't cover it, or maybe they just, don't have good insurance, or maybe they don't have insurance at all. Who knows? Um, but I've basically planned and set up a way to address those things to where we can have confidence that we're going to actually help satisfy a lot of the common things that we do see in those labs. But there's a lot of incredible information just from the simple blood test that I was telling you about. So, the white blood cell breakdown, the red blood cells, cholesterol. Cholesterol's huge. We always hear about cholesterol being a problem with it being too high. We never talk about when it's too low. And guess what? When cholesterol is too low, there's actually I have more concerns when it's too low than when it's too high, specifically for the brain and for the nerves, and how the nerves actually transmit signaling. Cholesterol is an absolute necessary piece for good brain communication and nerve communication. And if it's too low, that could be a big reason why some of these kids might be struggling too. Also, cholesterol is critical for good hormone function, and our body makes cholesterol. Our liver actually makes cholesterol. So the way that the world of medicine has made cholesterol to seem like such a bad guy is absolutely shocking to me because it's such a critical piece for good, healthy function in our brain, our hormones, and just our overall cellular health too.
I'll ask you about the routine blood test, using that as a starting point. With the what I'll categorize that as a routine blood test, can you look at that and formulate, I'm going to pick a number, maybe a 75% or so probability that, yep, got a good basis of understanding what your spectrum, your child on the spectrum of where they are, and then with that, I'm just picking a number, 75% probability. Start with a diet change, and then over time, now I'm thinking journey. Um, Over time, we can get to the point of where we want to be. And again, I'm asking, am I thinking correctly on this?
Yeah. No, I like where you're going with this. As far as like getting a good percentage in terms of like where they're at, again, it's so hard to quantify someone on the spectrum. You know, they call it the spectrum for a reason. I mean, I've worked with kids that, you know, if you interacted with them, you would never know they were on the spectrum
Hmm.
until maybe 20 or 30 minutes into talking to them. Then you're like, okay, I can see it. And then I've had kids that are in wheelchairs and diapers, you know, that are nonverbal and they, you know, can't really function for themselves. They can't be very independent. And that's usually more than just autism with those kids. There's usually some other genetic variations that are happening. But but I mean the spectrum is vast, right? It's vast. And so it's hard to be able to determine based off of blood work, oh, this person is X percent. I wouldn't be able to do that, but I could look at the blood work and I could determine if there is potentially like underlying infections or underlying things that are stressing the body, or if there is some genetic patterns that might be showing up through the blood work that could be giving us some indication as far as ways to support them and how they might need more of certain vitamins than other kids might. So that's definitely more an opportunity to get an idea of like where their body currently is at and how we could potentially influence it for the better with certain tools, certain things that we might consider as far as nutrition goes, and other supports that we could offer.
And yeah, in that context, forget the number 75 in this. I was that's just my thinking. But with the blood test, you can say, "Yep, that's here would be a good start." And you can adjust nutrition and so forth, and then maybe every 6 months another blood test to
Sure.
see if we're improving, kind of thing. Is that the iterative journey that people would need to be on?
I think, yeah, I think as far as having an objective way to measure that, that would be a good way to do it. There's other things that I use too that can be helpful. Is there's certain questionnaires that I'll use and I'll have parents fill those out because that also gives us some insight, you know, where it's like, here's the starting point when we started working together, fill it out every month. You know, going forward, looking at potential trends in terms of like their behavior socially, you know, what you might notice physiologically as far as some of their habits and things that might be happening. That's another way that helps us to kind of get some indication if we're also moving down the right path too. Because blood work, I wouldn't say it's the it's again, it's a great tool, and but there's a lot of times where some people have been told, "Hey, I came back from the doctor. The doctor said my blood work looks normal, but I still feel awful. You know, I still feel like crap." I've heard that. I've seen that many, many times. And so that's where it's just kind of understanding again, because there's not a test that a perfect test for everything, but you could, therefore dive into some of these other things that we talked about. But but yeah, so I think it is a good rule of thumb though. Like start there every 6 months, do some blood work, see how things are changing, and then continue to go forward to see with the different implementations you're putting in, then yeah, you can and should expect to see some positive things take place.
All right, I'm going to describe one aspect of our 19-year-old granddaughter. She would probably fit that category. You may need to talk with her for 5, 10 or so minutes to determine who she is. She can be very, very sociable. She can be more sociable with adults than other 19-year-olds, but she can be an open book and nothing vulgar about it. It's just that, well, gosh, yep, you were very candid in what you just said. People laughed, and well, maybe you and I would have thought maybe that would have been better left unsaid. But okay, it's already out there.
Sure.
She does not have any friends in the context of which you and I would consider friends. Therefore, she enjoys when she comes here. We are a point of relaxation. She can go into her bedroom and spend hours on an iPad, and very typical, I'm assuming. But yet, one of the things that we are on the lookout for, she can be overstimulated. And that's a very nebulous term to me. I understand generally what overstimulated means, but what if you were to continue doing what you're doing would cause you to be overstimulated? That's what I'm trying to learn. Marty and I both are trying to learn right now. We don't want you to continue on whatever you're doing, such that you're overstimulated, you're tired, and you're almost non-functional for X number of hours the next day. I don't know that I'm making sense with you, doctor, but those are some of the things that we are trying to work toward.
Yeah, no, that all makes sense. Yeah. Did you have a question with that?
The question is, can we determine with a person on the spectrum what to do, not to do to help them avoid being overstimulated? And again, by my definition, overstimulation, at least in our case, can result in a person being just overworked. It seems overexcited, such that they're not getting the rest they need, and it may carry into the next day that they are not as functional the next day as they could have otherwise been.
Okay. Yeah,
Just a
so
minute, I want to ask
please.
what what identifies, what could we see that's overstimulating? What is she doing that shows she's overstimulated?
Usually, a lot of times, things that can be overstimulating might be, if you've ever heard of the term stimming. So there's certain things that might excite their nervous system to a point where you see like sometimes the hand flapping or the repetitive like behaviors, or maybe it's like certain pacing, or maybe it's like tapping, or so it's like usually things that their body is just feeling so much overstimulation that they have to express it in a physical way. And it usually comes in the form of like you'll see a hand flap, you'll sometimes see them even like tapping themselves. Sometimes they might even kind of do things with their hands and their eyes. It's different. Again, it can be different. Sometimes it's in their voice too. Like they might even start using more vocal stimming, where it's like saying words, or even like sometimes screaming can be the case. Again, for your granddaughter, it's probably nothing like that, but that can be one of the things that I would say can be overstimulating. I know for like I have a daughter who's 10 years old, and there's times she, gets overstimulated. There's times I can get overstimulated, and for me, it's almost like, okay, I just need to go and just relax and just kind of take a moment, right? I remember my daughter after a dance recital, she had all her family around her, just like showing a lot of like, love and appreciation. But then there was a lot of other people. It was very chaotic, a lot of noise, and she just got like this moment where she was like very overstimulated, and we're just like, what's wrong? And she just like, there was just a lot of people, and it just kind of triggered me. So there's times where, it could be something like that, and just needing to go sit down, read a book, watch a show, maybe go for a walk. Those are things that potentially could be helpful too. But yeah, it's hard to say. It's very different for everyone. So sometimes kids that might be even more aggressive, or it could be, just different habits. It's usually like habits or things that you see them do on a repetitive basis. Then you can sense like, okay, they seem like they're being overstimulated. But
She works at a cafe and only part time, and she's the one that makes the drinks, and she loves it, loves doing that. And so she had extra hours, and Joanne, our daughter, she's a pediatric nurse practitioner, said, we have to be careful for how many hours she works because she'll become overstimulated. And she said one time, I just need to go to bed, to my bed, and my cat be with me, and
yeah.
just relax. So
hmm
that was her overstimulation, I guess.
Well, and that's a good strategy to cope with it. I mean, just if it's like go to bed a little early and have your pet with you, I mean that's great. So, but yeah, it's going to be a little different for everyone, and hard to always determine what that's going to look like. So,
And I'll tell you another time we had friends over and they have 8 kids. And so she met them. They were in the pool and it just goes, she goes, this is too much. This is too much. So she went to her room, her
yes.
bedroom.
Yep. Yeah, there's another young man that I have taken care of over the years, and when his nieces and nephews come over, you can see him he's quick to go to his room and just kind of stay put. He says the loud noises from his nephews and nieces is too much for him. So he finds that to be stressful.
Mm-hmm.
Doctor, as we bring this in for a landing, let me ask you, would you be willing to come back for another episode? And what I would be interested, and our listeners would be very interested in learning, how do you diagnose? How can you identify a person early on in life who is on the spectrum? Is this primarily through some sort of testing? Is it just conversation? All the above, but then more so, okay, now that we know, um, okay, where do I go from here? Because there are a lot of people who are just lost. And I know there's some parents, grandparents, caregivers who feel that, all right, yeah, my child is a little bit different. Other people see it, and now they separate from me socially. And so
hmm
there's that kind of thing that happens to some people. But I think it'd be interesting if you would consider coming back with us another time to talk about some of those aspects of how do we work with those who are neurodiverse once they've been let's say, officially diagnosed as such.
Sure. So, yeah, as far as joining you again, it'd be an honor. As far as the diagnostic side of things, that's not my expertise. So there's definitely a lot of different ways that people can officially diagnose that, and there's some different centers that are around close to where I live. So I'm just north of Salt Lake City in Utah. And, there's families that have reached out to me and asked if there's a way I can do that. And I tell them that's not my expertise to do the diagnostic side. I'm more help once they've got the diagnosis, or if there's an assumption that their child's on the spectrum, then I'm still willing to work with those families. And so that part I wouldn't be a great resource in communicating all the criteria that basically considers the diagnostic criteria. However, we could talk about, the common things that we do see in individuals that might be diagnosed on the spectrum, and some of the common patterns or things like that. as far as like how to best navigate. There's a lot of different strategies. There's we've all heard the saying, it takes a village to raise a child. And I would say it takes a village of healthcare practitioners and therapists to help a child on the autism spectrum. And so, like, my piece that I focus on is more on the cellular healing and the detoxification and supporting the organs and glands internally with good nutrition and supplementation and detoxification. Whereas there's other great therapists that can contribute in a really beautiful way, such as speech therapy or occupational therapy. Some families have had a lot of success with ABA therapy. And it's interesting. There's so many different opinions on all those things. I would say primarily ABA. There's some parents that are very, very happy and for it. And then I know several parents that are just like, I have no desire to do anything with ABA therapy. I don't like the way it's structured. So again, these are just resources, of course, and things that people have used that have been helpful. And then there's even some other resources that I would say you could call them like biohacking tools that have been helpful as well. And those are things that can be utilized in conjunction with all this other stuff. So yeah, if there was a time you wanted to discuss more about some of those things, we could, and share some insight as far as other things parents can consider, and grandparents and caregivers. Sure.
Our listeners can definitely benefit from that. Dr. Jeff, thank you so much for your research, your expertise. We are all learning together, and it's a learning journey. Thank you so much.
You bet. Thank you for allowing me to be on the show with you today, Ron and Marty. It's been an honor. So keep up the good work and all the good things you're doing.
Thank you.
We appreciate having the opportunity to share our and our guests' life experiences with you.
The Cooper culture advances organizations to achieve and sustain high retention rates, connected communication, and trust through personality insights and principled leadership. You can contact us at our website, thecooperculture.com, and you can contact us directly at ron@thecooperculture.com or Marty, Marty, at thecooperculture.com. We work with you to help assess aspects of your culture to advance the environment and people to their best performance. We do that through our staff of certified personal performance coaches, leadership trainers, keynote speakers, and DISC personality behavior experts. You can book a speaking engagement directly through our website by contacting us at ron@thecooperculture.com. We look forward to sharing our life experiences with you, some of which are profound, some of which are pretty funny. Some of those life experiences are ones we'll never do that again because we've been through stuff. We truly look forward to working with you, speaking with you, helping advance you in any way that we can.
This is not a commercial for The Way I Heard It with Mike Rowe, the award-winning podcast now entering its 10th year and available wherever podcasts are listened to. No, this is a commercial for Mike Rowe's foundation, which has just set aside $10 million to help train the next generation of skilled workers. That money is available right now at microworks.org. It's waiting for anyone who wants to learn a skill that doesn't require a 4-year degree. Electricians, plumbers, linemen, welders, shipbuilders, HVAC techs. America is desperate for men and women with skills they don't teach in universities. And the MicroWorks Foundation is committed to helping train America's workforce for hundreds of thousands of AI-proof 6-figure jobs just waiting to be filled. Apply today for a work ethic scholarship at microworks.org or support our efforts with a donation of any size. We're closing America's skills gap one job at a time, and we could use your help at microworks.org, MIKEROWE works.org.